with a thoracic injury that has back pain. That's a given. This is the patient that might have trouble breathing in and out deeply using the incentive spirometer, might end up with lung infections because the thoracic spine is not working properly or not, there's some kind of injury there. The patient with lumbar, and again, thoracic is still going to affect bowel and bladder. Anything below the level of that injury is going to be affected. Somebody with a lumbar injury, you're going to be thinking bowel and bladder. They might need a straight cath the rest of their life. They might need a Foley catheterization. They may have trouble with constipation because they don't feel the urge to go, or they might be incontinent of bowel because they have lost the nerves here in this level of injury that affect our bowel and bladder. So we have to always be thinking, where's the level of the injury if there's a spinal trauma? There are things that are disorders. There's 3 different types of disorders, and all they really mean is there's something to do with the spine itself. There's some kind of abnormal curvature, basically, in the spine. If it's kyphosis, that's the patient we just talked about with osteoporosis, where their upper back kind of has that hunched over. Again, we have a little bit of a curve here, but we should not have a significant curve, and that develops sometimes over time. Is it painful to the patient? Not always. It's just something that we see that in time your spine degenerates and changes its shape. If somebody has an inward curvature, too far inward of their lumbar spine, it's called lordosis. Scoliosis is like an S shape to their spine, and I'll show you some pictures of that. So there are different spinal disorders. It's different than spinal trauma. If somebody has a spinal cord injury, that's way different than this. This is just basically a disorder of the spine that usually develops or congenitally, meaning the patient was born with an abnormal spine. When do we start screening for scoliosis? Usually in in school, they do school screening. The school nurse will do scoliosis screening to determine, is that spine straight and in alignment? And if the patient has a significant enough S shape to their spine, it can affect their lungs, their bowel, their bladder, their ability to, as they grow straight, both their legs be even. So that scoliosis can become significant, and the patient might have to wear a back brace. And that's what we're going to talk about for the next couple minutes, and then won't be long. So we just have to recognize where our cervical spine is, C1 through C7, thoracic spine, T1 through T12, lumbar spine, L1 through L8. So if somebody has an injury and it says the injury is at T12, you've got to at least recognize what part of the back that is. Here's our sacrum, S1 through S5, and then we have the coccyx bone all the way at the end. So the 3 main types of spine disorders, and they're listed here: lordosis, kyphosis, and scoliosis. Kyphosis is the abnormally rounded upper back, more than 50-degree curvature. Normally, kyphosis, less than 50-degree angle. Now this patient might have more than 50 degrees here in this angle that we normally see. You do have a little bit of an angle there normally. That's how your spine is. But when that angle becomes greater than 50 degrees, that's when you have that abnormal, almost like humpback appearance to the upper back. That's what kyphosis is. Lordosis is the inward, this part of the spine, the lumbar spine, is too far in. Can you have both of these things at the same time? Yes, you can. This is going to affect more your GI tract. It's going to affect more your bladder. It's going to put more pressure on your bladder. The patient might have more problems with incontinence. They may have more difficulty walking, depending on how significant this inward curvature becomes. Can we correct some of these things? Yes, we can correct them with braces, but people that wear back braces to correct these things, many times a back brace has to be worn 23 out of 24 hours a day. It's hard to maintain, hard for the patient to tolerate, but it can happen. Can we do surgery to correct people's back problems? Yes, they can have spine surgery. One thing to remember, if somebody has a spinal disorder and we are going to be moving them, or they had spinal surgery, how are we going to pick to move them? Always pick log rolling. Log rolling is that somebody is standing at the head and we move the patient as a unit. Somebody stabilizes the head and we move the whole spine as a unit. So particularly if there's a spinal injury or spinal surgery, we don't want to be the ones that abnormally turn the patient's body and cause them to flex or put pressure or damage nerves where that spinal surgery was. So if you're looking for an answer for a spinal injury patient, it's going to be log rolling the patient. And usually it takes two people at least to be in that room and move the patient side to side in order to do their care or whatever you're doing, kind of as a unit, and keep that spine in alignment. That's what you're going to want to pick. So here's your three spinal disorders: lordosis, kyphosis, and scoliosis. Person with scoliosis has that S-shaped spine. I'll show you a picture of it in a minute here. So lordosis, that's your lower back, where the lower back is inward. A lot of times these people with spinal disorders, it depends on how bad it is. If it's mild spinal curvature, they might do PT, they might do OT, they might wear a back brace. We're going to have them lose weight, because losing weight is only going to help them put less pressure on that spine. They might need medication to relieve pain and swelling. And those meds could be NSAIDs. Those meds could be Tylenol if it works. Those meds could be those DMARD meds again, right, that are anti-inflammatory. It just depends on how bad that spinal disorder is and how much pain the patient's in. Always are going to have exercise and physical therapy, something to increase their strength and flexibility. They may wear a back brace, and if it's significant enough, we may have to end up doing surgery. Treatment for scoliosis, what happens? If it's mild, it's just going to be observation, and hopefully the patient in 4 months gets reevaluated and that S hasn't gotten any worse. Can people live with mild scoliosis and walk around? Yes, absolutely. But if that S curvature continues to get worse as that child ages, we're going to see an orthopedic doctor, and we're going to recommend a brace for that doctor, for that patient, in order to try to keep, as that spine, as a child is growing, get the spine back in alignment and out of that S shape. So again, depending on the degree of the curve, a back brace is sometimes prescribed for kids and adolescents who are still growing. Bracing can help from it getting worse. The brace doesn't work, observing hasn't worked, and it's getting worse. We may have to end up doing surgery, and sometimes that's needed, sometimes it isn't. And you probably go have, the child probably go to like AI or someplace like that in order to get that treated. Kyphosis is that upper spine, and you have that hunchback shape of the upper spine, abnormal degree to the thoracic spine. It's bent too far out. And again, what are we doing? Exercise, anti-inflammatory medications. If it gets bad enough, the patient might wear a brace. It doesn't change. It just depends on the extent of the injury, not the injury, but the extent of the disease and how it's affecting the patient. Remember, what's our goal? Quality of life, preserving the patient so they don't get any worse, and minimizing their pain. And if the patient's not in pain, it may not even be treated. It may be that they've aged, they've developed osteoporosis, they have that abnormal curvature of the thoracic spine, but we don't really have to do anything about it because it's not hurting the patient. So here's our cervical curve. This is normal. There's our thoracic curve. It's normal. Our spine is not completely 180 degrees. We do have a little bit of curvature to it. Here's the lumbar curve that's normal. If the patient has kyphosis, this curve here is way out, and the patient has more like a hunchback kind of shape to their upper back. If they have lordosis, this curve, rather than being out, is more inward. And so the patient has more pressure inward from their spine. And then scoliosis is just that S shape. So again, you could get lordosis, inward curvature of your cervical spine. You could get lordosis of the lumbar spine. This is just showing you a picture of it. And basically, you just need to recognize where the cervical spine is. What is a picture of kind of our normal curvature right here, C1 through C7, T1 through T12. And again, it's L1 through L5. I thought there was 8, but there's 5. Here's your sacrum, and then there's S1 through S5 for sacrum, and then there's the coccyx. This is just a picture of a normal curvature of our spine. Compared to too much of a curvature here, that's kyphosis. Inward curvature here, lordosis, and then the S shape is scoliosis. I just want you to recognize what they are. This is a kyphosis spine. See how this person is a little more hunchback. This is upright. You still have a little bit of a curvature here. Inward curvature here, that's normal. This is perfectly normal. This is what a normal spine would look like on an x-ray. This is the person with kyphosis, and this is a patient that we usually see. Go back to our osteoporosis person. This is the middle-aged, the older adult lady, postmenopausal, has developed osteoporosis. This is just one more sign and symptom that we a lot of times see with osteoporosis patient. And maybe they have pain, maybe they don't. It just depends on if we treat it or not, if we're managing the patient's pain level. So here's normal, and then this is kyphosis. The spine over time degenerates some, and that outward curvature is more than it should be. Lordosis is inward curvature of the lumbar spine, too far in. So here's your kyphosis patient, another picture of them. This is them walking upright at, who knows, maybe age 40 or 50, and then this might be at age 75 or 80, where they have a little more hunchback, they've lost height, that's normal, normal aging, I should say, and then they have that humpback, kyphosis or kyphotic shape is what it's called to their upper spine. Here's scoliosis. This is a normal spine. And then this is scoliosis. They almost are like a C or an S. It's curved. It's not up and down. How is a child checked for that? The child is taught to bend over, and then the doctor evaluates the spine. And when they see this S shape, it's easier to see as the child is bent over. You can see that the spine does not stay in alignment straight up and down. What normally happens for a child that has scoliosis, if it's mild, maybe 10 degrees or 15 degrees, one way or the other, they usually just observe the patient. If you're talking 30 to 40 degrees, now they start talking about putting a brace on that child. And the child usually wears that brace almost 24 hours a day. So a lot of kids don't tolerate it, but if it's the only option, it's the only option in order as they're growing to keep that spine in alignment and let it grow straight as the child is growing. So that's what scoliosis is. I showed you a picture of it. Again, treatment is based on the age of the person, the size of the curve. Mild curves are just usually observed and checked again, but moderate curves might need braces, and the severe curves might need surgery. So one thing to remember with the spine, again, it just depends on the extent of the curvature, the pain of the patient, the age of the patient. If a patient is 80 and has kyphosis and they don't have pain, we're not going to make them wear a brace. That's not going to improve their quality of life. They're already 80 and that's expected. If a child is 5 years old and they go to a screening at school and they have scoliosis that's already starting to develop, well, that's the child that might end up with a brace because they're going to continue to grow and we need that spine to grow in alignment. So it just depends on the patient, their age, how bad it is, and then we determine what we're going to do. I think in one of your chapters in your med search book, they do talk about these different curvature disorders of the spine. That is way different than a spinal cord injury, which we've talked about before, which basically, based off of the level of the injury, is kind of what determines what we see for the patient. So these patients, bracing is important. You should have had some questions that come up in your musculoskeletal questions about bracing. One thing to remember, if the brace is needed and prescribed and it's severe, many times that brace is only removed like for AM care or whatever you want to call it, for the kid to get a bath or a shower, and then the brace is put back on, and they actually sleep with these braces on. So it's hard for the kids to tolerate, but it has to be done in order for them to grow and grow upright. The only other thing I'm just going to mention real quickly is fibromyalgia. What is it? Basically similar to chronic pain syndrome. Do we know the cause of fibromyalgia all the time? No, it's a musculoskeletal disorder. Yes, it is real. Most of the time the patients have fatigue, body aches. They might have problems with irritable bowel. They might get headaches. These are a lot of different signs and symptoms. The thing about fibromyalgia, hard to diagnose because these are like general symptoms that could be a symptom for a multitude of other things. So many people with fibromyalgia don't get diagnosed until they figure out they don't have 20 other things, and now they give you this diagnosis. How do we treat fibromyalgia? Sometimes it's antidepressant medication, sometimes it's steroids, sometimes it's NSAIDs, depending on the symptoms that the patient has. Is there any specific diagnostic tool or test for fibromyalgia? No, it's basically a diagnosis of exclusion, and all that really means is we've excluded 20 other things. We know you don't have this, or this, but you still have symptoms. Yes, your symptoms are real. How are we going to treat those symptoms? So sometimes it's antidepressants, not because the patient's depressed, but because they seem to work and treat these symptoms. Patient might be taught relaxation exercises. Stress a lot of times triggers symptoms of the patient that has fibromyalgia. So they might be put on anxiety medications. Again, it just depends on the patient and what would work for them. And usually this is hard to diagnose and takes a long time to diagnose. It is real. There is a disorder and there is a diagnosis of this, but many times the diagnosis is made after the patients have, many tests. How do we treat it? If you have a question on reflex about fibromyalgia, it's basically antidepressants. Could be anti-anxiety medication, minimize stress. Relaxation techniques are good for this patient. Symptom management, and basically exercise, because exercise is known to stimulate, obviously keep your muscles strong, but also stimulate neurotransmitters, which help you feel better. So this is basically kind of their medical management, I guess, of this. There's no specific test that we can say, okay, like rheumatoid factor, it's different. There's no specific test to diagnose somebody with fibromyalgia. Okay, before we go into muscular dystrophy, we'll probably do that tomorrow because it's a whole different category and there's a couple different types of muscular dystrophy. Any questions about osteoarthritis, rheumatoid